Okay, we're continuing with Prevent and Reverse Hypertension by me, Pete Rogers. We're on part 14. We're starting on figure 2-8. So the higher the LDL cholesterol, the higher the blood viscosity. What that means is the thicker the blood becomes. Thick blood means your blood becomes like a milkshake instead of like water. The purpose of blood pressure is to pump blood to the top of your brain. So you have to pump that blood against gravity. If the blood is thin like water, you don't need a lot of pressure to pump it. If the blood is thick like a milkshake, pressure has to go up. Then you got blood vessels, and if you vasoconstrict them, make them narrow because you have a lot of sodium in your diet, then you're pumping thick blood through a constricted system, pressure has to go up. Okay, and hypertension is one of the main risks of atherosclerosis and stroke. I'll show you why right here. We're going to talk now about laminar flow. This is figure 2-9. So basically, blood flow is like your hand. The fingers in the center are the red blood cells. They flow the fastest. It's a parabolic velocity profile. Right next to the two central fingers on each side of the white blood cells. And then like your thumbs would be the equivalent of the plasma, which flows adjacent to the wall of the artery, the endothelial cells. This is called normal blood flow, laminar blood flow. Okay? That's how it's supposed to be. When pressure gets high, what's going to happen is you're going to come to bifurcations. And if the pressure is excessively high, it's going to hit against the median divider. So here is the neck, here's the external carotid, internal carotid. And the internal carotid is like your thumb, goes up to the brain. External carotid is a bunch of branches that go to the face. When it hits the median divider, the soft tissue in between the ECA, external carotid artery, ICA, internal carotid artery, the initial supplying artery is the common carotid artery in the neck. High pressure has excessive bounce off the median divider, so you get excessive turbulent flow. Turbulent flow is chaotic flow, and it's non-directional. Retrograde flow are these backwards currents, also called eddy currents. When there's excessive turbulent flow, excessive retrograde eddy currents, it confuses the arterial lining, and those are the endothelial cells, and they will shed their antithrombotic glycocalyx. Glycocalyx is the coating of the cells. They will release that into the bloodstream. And beneath that is these prothrombotic molecules, things like VCAM, vascular cell adhesion molecule. And then you start forming clots. The blood will stick to the arterial wall. It'll form these clots just opposite the side of the median divider. I see these things every day. I mean, this is just typical carotid artery atherosclerosis. In the heart, you've got tons and tons of little bifurcations all over the place. In the neck, you just got this one big bifurcation. And that's why atherosclerosis is caused by hypertension, because it damages the arterial wall. The endothelial cells make a lot of nitric oxide. That's the most important thing they make. It's a gas. Nitric oxide diffuses into the lumen of the artery, interacts with the platelets, and prevents them from clotting. It diffuses into the wall of the artery, enters the smooth muscle cells, and it blocks them from contracting, so the artery stays dilated, stays open. That's really the only thing you need to know about endothelial cells. It has other things that are antithrombotic, like its glycocalyx, we talked about that. The heparin sulfate and their negative charge, their zeta potential. Antithrombin 3 molecule binds to the heparin sulfates. Okay, they also make TPA, but all of that, you really don't need to know it. You need to know nitric oxide, though. That comes up a lot. Okay, the endothelial cells are lined up along the long axis of the artery. So they have directional sensitivity to the flow. That's how they can tell when the flow is chaotic or retrograde. Okay. Red blood cells typically live 120 days, and then they're cleared out by the spleen. The spleen is like the graveyard for red blood cells. As time goes by, the red blood cells become progressively more stiff, less deformable. Red blood cells 7 millimeters in diameter. Capillary is only 5 millimeters in diameter. So it has to, fold back on itself a little bit to pass through a capillary. The splenic sinusoid filters are only about 3 microns in diameter, so the red blood cells have to be especially flexible to get through those. They can't get through those, they get cleared out by the splenic macrophages, all right? And our RBC becomes progressively more thick over time because it gets more glycated. You also got externalization of relatively stiff phospholipids, okay? Okay, like phosphatidylcholine, okay? Phosphatidylserine. All right, the spleen is like the graveyard for red blood cells. So yeah, it's the phosphatidylserine in particular that gets externalized to the outer leaflet of the plasma membrane, and that causes the red cells to become stiffer as they get older, and then they're cleared out in the spleen. Okay, here's a little diagram of that phosphatidylserine externalization. So they start out in the inner leaflet of the plasma membrane. Cytoplasm is over here, And as older the RBC gets, the more of these phosphatidylserines flip into the outer leaflet of the plasma membrane, and that makes the red blood cell stiffer, and then it gets cleared out by the spleen. Oh, here's a question. Why do women live longer than men? So, of course, everyone says it's because they're not married to women, but it's thought to be most likely because they menstruate. When they menstruate, they lower their hematocrit, which means they lower their blood viscosity, because over 99% of the cells in the blood are red blood cells. So you lower your hematocrit a lot. That lowers your blood viscosity, then you have less hypertension, so you get less atherosclerosis, less cerebral vascular disease, and you live longer, okay? And the other reason they live longer is because they get to rip off their husbands in divorce. Okay, so the husband does all the work and then they steal the money from him. And America promotes that because it wants feminism to destroy the country. Okay, let's see what else. So they have less hypertension. When red blood cells first come out of the bone marrow, they're more flexible, more deformable. That also contributes to them having lower blood pressure. If a woman has a hysterectomy, then she stops menstruating, and so her blood pressure becomes like a man. So women who have hysterectomies below the age of 35, they tend to die sooner. They're much more likely to end up with coronary artery disease, with cerebral vascular disease. Like whenever I look at a demented brain and the woman is unusually young, let's say I see a demented female between the ages of 45 and 60. First thing I do is first of all, the usual suspects. Is she an alcoholic? Is she a smoker, a drinker, a drug addict? All that stuff. Okay? Then the next, is she an HIV positive prostitute, something like that. But if she doesn't fit those, sort of usual common categories, the next thing I do is I look at her gynae history and see if she had a hysterectomy. And that's usually what it is. Okay, she had a hysterectomy, so she became hypertensive. She wasn't aware of it, and she started having a bunch of strokes and other problems. Okay, Mayo Clinic studied over 2,000 of them. Women who had hysterectomies before age 35, they have all kinds of health problems. All right, I think we're going to leave it for today. I hope you found that helpful. We'll start off here when we do the next one.